Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to speak with you about non-medical treatments of overactive bladder. There are behavior techniques that each and every one of you can use that will help improve your symptoms of frequency, urgency, and urge incontinence. I would like to point out to you that incontinence is more common in older men and women, but it is not, and I emphasize not, a normal part of the aging process. I want to talk with you about pelvic floor muscle training. You can perform voluntary contractions of the muscles in your pelvis that will help stop the bladder contractions. I recommend that you do quick contractions or quick flicks to stop the bladder contractions when they occur. There are proper techniques that you can use to reduce urge inhibition of these symptoms of overactive bladder. You can break the response of rushing to the toilet when urgency occurs. What do I suggest that you do? First of all, stop with whatever you are doing. Sit down and start contracting the pelvic muscles. Use any distraction technique until the urge passes. This technique helps overcome urgency, frequency, and urge incontinence. Other recommendations that I would suggest include exercise. Even walking decreases the risk of incontinence. Weight loss is also important, as obesity increases the urgency and stress incontinence, and patients who have had weight loss surgery have reported far less episodes of urinary incontinence. I also encourage you to stop smoking, as smoking is associated with coughing, and that can stimulate the symptoms of overactive bladder with urgency, frequency, and incontinence. Also, there's dietary modifications such as caffeine restriction, and I also suggest decreasing acid-producing foods such as citric fruits and citric juices. Other recommendations include time voiding, where you increase the time interval between voiding episodes. Use a watch with a ring alarm that lets you know how much time has elapsed, and try to set that for ever increasing periods of time so you can increase the interval between voiding. Try to increase the interval by 15 to 30 minutes, and you will see that you will have significant improvement in your urgency and urge incontinence. Another recommendation is fluid restriction. However, this is only a short-term solution, and this is used only in patients who seem to be consuming large quantities of fluid. Pelvic floor muscle training consists of doing sets of 8 to 12 maximal contraction, and each contraction should be held for 6 to 8 seconds with a 6 to 8 second rest interval between the sets. At the end of each set of series, I recommend 5 to 10 rapid contractions or quick flicks be performed. The exercises are repeated at least 3 to 5 times every day. In summary, overactive bladder is a common condition affecting millions of American men and women. There are non-medical techniques that can help alleviate this condition. Bottom line is, see your doctor, because in this time and age, no one, and I truly mean no one, has to depend on depends. For more information, I refer you to my website, www.neilbaum.com, or contact my office at 504-891-8454. Thank you.